Vaccine was approved for everyone 5 and up. Health officials have been stressing the importance of children getting their COVID-19 vaccine. But through this pandemic, have families been keeping up to date with other routine immunizations as well? 6 News reporter Josh Sanchez caught up with health experts to find out. Josh?
Sarah, according to the CDC, fewer children got their routine immunizations during the first part of the pandemic. Health experts with Michigan State University say that the state was already behind with routine vaccinations before the pandemic hit. They say issues like scheduling appointments to more hesitancy contribute to even less children getting their shots. One doctor says it's leaving kids vulnerable.
Though measles is not common, if children are not immunized against it, they are vulnerable if the disease is imported into one of our communities. And that will happen because people travel so much.
Dr. Keith English is a pediatric infectious disease specialist who teaches at Michigan State University. He says since the pandemic hit, fewer children are up to date with their routine immunizations.
And the sad news is Michigan ranks lower than it should already in terms of our overall immunization rate for young children. And we were making some progress in closing the gap before the pandemic started.
Dr. English says one reason why rates are so low is because it's become more difficult to schedule a doctor's appointment. He says that's because healthcare workers have been overwhelmed with COVID patients. Psychology expert Dr. Zakia Alavi says some parents were even concerned of visiting a doctor's office because of the potential risk of COVID-19 exposure. Dr. Alavi says lately she's been starting conversations with parents to get their opinions on this.
We have been having more discussions, more gentle reminders, more open-ended questions about, have you vaccinated your child? What are your thoughts about getting vaccinated? So on.
Dr. English says it will take coordination between doctors, health clinics, and departments to make it easier for parents to schedule those vaccines conveniently. Medicine, he says, he has seen work.
New vaccines have saved so many lives in children in this country and around the world. It's been one of the most remarkable and wonderful things in my career as a pediatrician.
Now, Dr. English went on to say that if someone has any questions about vaccinations, they should contact their primary care doctor.